This morning, we'll have a look upon overdiagnosis in psychiatry. It is the first time we've got a special session about psychiatry and overdiagnosis. We've got three speakers with different perspectives. First, Alan Francis, well-known psychiatrist who chaired the task force working with the diagnosis classification DSM-4 back in the 90s. And since that, he's been critical against the development in psychiatric diagnosis and the use of it. Second, we'll have Anders Petersen. Anders is a sociologist from Denmark who works with the diagnosis in a cultural and social perspective. How does the diagnosis reflect our culture? And the third, Olga Runkeman, who's a psychologist and activist. She's having an inside and an outside perspective on diagnosis, which I'm sure she'll tell more about. Each speaker will have 20 minutes, and after that, we'll make a debate. So please prepare very, very short and precise questions for the panel. Thank you. Okay? Alan, are you ready? Okay, let's go.
Lewis Carroll wrote Alice in Wonderland 153 years ago. But there's a very brief conversation between Humpty Dumpty and Alice that is crucially vital to the central point in this conference. Humpty Dumpty says to Alice rather scornfully, "When I use a word, it means just what I choose it to mean. No more, no less." Alice is skeptical, and she says, "The question is whether you can use a word with very many different meanings." This offends Humpty Dumpty, and he says, "The question is, who is master? That's all." I think it's been clear in this conference that disease definition is one of the most important causes of overtreatment. And the problem is, how do you define disease? Who gets to be the Humpty Dumpty defining disease? Unfortunately, although our language, human language, is very supple, enormously useful, it's also frustratingly imprecise. And there is no good dictionary definition of disease that tells you which conditions should be diseases and how to define what are the thresholds for the conditions that we call diseases. There's no operational definition of disease or illness. Usually, the dictionary resorts to a tautological definition. Disease will be some absence of health. But then, if you turn to the definition of health, you'll find that health is the absence of disease. The circular definitions that promote imprecision. I spent a lot of effort trying to figure out a definition for normal. It's the exact same problem. That normal is the opposite of abnormal. Abnormal is the opposite of normal, and each word is chasing the tail of the other. When I took over the work on DSM-4, I wanted to have established foundations that would prevent the experts from being Humpty Dumpty and choosing whatever meanings for disease they prefer. So I looked at about 50 definitions of mental disorder and actually wrote one. And they're all useless when it comes to defining which conditions should be in the manual, which not, and for the conditions in the manual where the thresholds should be drawn. Now, you've heard a great deal in this conference about the problems in medical practice because most disease shades imperceptibly into health, and it's difficult to draw the boundaries. If you have the Humpty Dumptys of the American Cardiology Association doing the defining, they can, with a stroke of the pen, make 247 million Chinese who were previously healthy suddenly suffer from hypertension. In psychiatry, we have that very same problem, and we're going to be discussing in a moment the boundary, the very fuzzy boundary with normality. But first, we have a problem additional to the rest of medicine, or two problems additional to the rest of medicine. The first is that our boundary is not just with normal, everyday aches and pains, disappointments, sadness, and anxiety of everyday life. Our boundary is also with bad behavior. And that many behaviors that are just evil and bad are mislabeled as mentally ill. And I'm going to give you a number of examples of those. The other part of our dilemma that's unique to us is that we've criminalized mental illness. So people wind up in jail for what is essentially mental illness. And I'll be discussing that as well. But first, let's begin with confusing evil with mental disorder. And the most current example of that is Donald Trump. 27 psychologists wrote a book called The Dangerous Case of Donald Trump. 62,000, at my last reading, psychologists and other mental health workers signed a petition that Trump should be removed from office on the basis of mental unfitness under the 25th Amendment of the Constitution, which would require the cabinet led by his vice president, Pence, to first declare him mentally unfit and have Congress then vote to remove him from office. I strongly oppose these efforts for three reasons. One, Trump is a bad person to be linked with. The mentally ill have enough problems without having Trump join their ranks. Most mentally ill people are well-meaning and well-behaved, neither of which is Donald Trump. He's a corrupt person, a con man. He's not mentally ill. He's bad, not crazy. The three arguments raised by the people who would have psychologist kings depose Trump are first, that he has narcissistic personality disorder. Second, that he has delusional disorder. Third, he's demented. I wrote the criteria for narcissistic personality disorder in 1978. We never dreamed that those criteria would be used for psychological name-calling. They were meant for clinical purposes. The criteria barely made it into DSM-3, and in DSM-5, they were almost removed. The diagnosis, narcissistic personality disorder, is a tenuous one in psychiatry. It won't appear in the International Classification of Diseases next year. No one could ever be removed from the presidency of the United States based on having narcissistic personality disorder. Too many of our presidents could easily be so labeled. Too many world leaders easily so labeled. Indeed, Trump is a world-class narcissist, not just for our time, but for the ages, and going back to Nero in ancient Rome. But that doesn't mean he has a personality disorder. In psychiatry, you not just have to have the symptoms, you have to have considerable clinical distress and functional impairment as a result of the symptoms. Trump causes distress in others and is impairing our world and our democracy in the most remarkable way. But he doesn't suffer himself very much. And instead of being impaired, we've rewarded him with the highest office in the world. How about delusional disorder? Trump believes, well, at least he spouts, and probably believes a lot of really nutty things. But to have delusional disorder, you have to be a minority of one. Trump has 40% of the population believing what he believes. About 40% of our population believing all sorts of conspiracy theories. If you have 40% of the population on your side, that's not delusional. It's ignorant. It's dangerous, not delusional. And people claim he's demented because he uses the same words over and over again. I use the same words over and over again. If you do speeches a lot, you use the same words over and over again. It's a mistake to underestimate Trump. It's a mistake to think that he's just a buffoon. He's a genius at what he does. Our brains have only 3 pounds. They can devote themselves only to certain things. If you devote yourself to self-promotion and exploiting others, there's very little room left for rational decision-making. But Trump is a genius at what he does. So we shouldn't be loosely using psychological name-calling as a political device. Trump needs to be defeated. He won't be defeated by psychologists. He'll be defeated at the election in 2018, we hope. Second example, the U.S. has a mass murder just about every day. Just about every day we have a murder in which 4 or 5 people are killed. Our rates of homicide are multiples of 10 to 20 of other partner countries. Why? According to the NRA, when someone shoots a gun and kills 5 people, they're mentally ill. People kill people, not guns. And they do their best to distract attention from the major cause of gun violence, guns, and the other important causes, the social disruption, economic displacement, poverty, and a president who's constantly spewing hate. We can't allow the distraction of calling someone mentally ill after they've committed the crime, but insisting they have a right to the gun before the crime. We have to focus on the social issue, not use, again, loose psychiatric terminology. When Harvey Weinstein was caught raping actresses, he went to a sex addiction program. When Tiger Woods was caught being promiscuous, he went to a sex addiction program. In the old days, people caught in such situations claimed they were sinners, that they had found God, and they needed forgiveness. Now they claim they're mentally ill, and it's not me that did this stuff, it's my mental disorder. The DSM has roundly rejected sex addiction as a diagnosis. Unfortunately, it will be in the WHO ICD-11 to be published next year. But this is a great mistake. Again, we shouldn't allow immoral behavior to be misclassified as mental disorder. And last, I won't spend time on it because it's a complicated issue. In the United States, rapists who have served their sentence can be committed to psychiatric hospitals, perhaps for life, on a vague, improper, DSM-rejected diagnosis of coercive paraphilia. So that when we use words loosely, and here the word's been rejected by the official system, but it's still used in the courts. When mental disorder terms are used loosely, they can cause great mischief outside of the clinical situation. Okay, but let's now go from mad to bad to mad to sad. You've heard already that 1 in 4 Americans could be classified as having a mental disorder in the previous year, about half lifetime. That 1 in 5 Americans is taking a psychotropic drug on a regular basis. And this doesn't even count the 3 million Americans who are hooked on opioids, many of whom for related psychological problems, some for just plain medical problems. We have 1 in 8 Americans on an antidepressant. Amongst women over 40, it's 1 in 4. Amongst teenagers, 4% are on antidepressants. We have about 15% of our kids getting a diagnosis of attention deficit by the time they're 18 years old. And almost half of them will have been on medicine during some of that time. We have a tremendous overuse of antipsychotics, particularly in kids and in the elderly. And in the elderly, it shortens life. The drug companies have successfully turned what were excessively loose DSM criteria that were meant for clinical purposes, have been able to advertise the ills directly to the public on television. So almost every third ad in the United States is a drug ad. And they presented the absolutely misleading but compelling argument that most of the sadness, anxiety, eating problems, sex problems, you name it, of everyday life, that most of the human condition is a undiagnosed aspect of mental disorder, that this is a chemical imbalance and that it requires a pill. Sell the ill in order to peddle the pill. It's an absolute disaster economically. It's very harmful to the people who are unnecessarily put on medication. Many of the medications, particularly the benzodiazepines, which are just plain evil. And benzodiazepines should not be used at all for psychiatric problems or anxiety. They're dangerous drugs with almost no psychiatric indication. We have the side effects piling up on patients who don't need the medicine and the tremendous expense involved. The stigma, a psychiatric diagnosis should take a long time. Not just a long time in one session, but serial sessions. It's a very important moment in a person's life. A good diagnosis is a wonderful thing. It helps the person understand what was previously very disturbing and confusing. An accurate diagnosis gives you a sense of being part of a group. You're not uniquely damned all by yourself. And there's something we can do about this problem. An incorrect diagnosis, and most diagnoses these days are incorrect. 80% are made by general practitioners. 80% of the medication is prescribed by general practitioners. Usually in the US after 7 minutes, very often under the heavy influence, both the doctor and the patient, heavily influenced by drug company marketing. Once you get a diagnosis, very hard to erase. Psychiatric diagnoses should be written in pencil, but they're written in magic marker. And the effects we'll be hearing about soon can haunt you for life. Very easy to give a wrong diagnosis, very hard to erase it. Very easy to start an unnecessary medication, very hard to stop it. For some medications, particularly the benzos and the SSRIs, there are withdrawal symptoms that make stopping hard. For others, there are the problem of psychological dependence. You believe the medicine made you well, even if the problem was cured more by time, support, resilience, advice. That most people who get a benefit from antidepressants don't need the antidepressant. It wasn't from the medicine. It was from the placebo regression to the mean and time effects. Now what's a horrible result of the overdiagnosis? There's a terrible paradox, a misallocation of resources. We're way over-treating the worried well, and meanwhile, we're criminalizing the mentally ill, the seriously ill. There are about 5% of the population have a severe mental disorder. In the US, the services for that population have been destroyed by Republican administrations going back to Reagan. The average person with a severe mental illness doesn't have access to treatment. The cops have learned that bringing an individual who's screaming in the night or stealing some food from a grocery store, bringing them to the emergency room, floridly delusional, is a complete waste of time. That there's no appointment, there's no bed for hospitalization. We've closed 600,000 beds in the US in the last 60 years. We now have 350,000 mentally ill patients in prison, 250,000 mentally ill patients roaming the streets. We're over-treating people who don't need it. We're shamefully neglecting the people who do. What can we do about this? We are Davids fighting a Goliath. There are only a few thousand people in the world who care about overdiagnosis. There are millions promoting overdiagnosis. There are only millions of dollars spent to stop overdiagnosis. There are tens of billions of dollars spent every year to promote overdiagnosis. It is a losing battle, and we are losing it. The smart money, people who invest in drug companies and hospitals, all see them as a growth industry in the future. They don't see us as a blip that will disturb the pricing of the services. What can we do about this? We have to get outside this room, and we have to have a slingshot and a pebble. The pebble's obvious. The pebble is truth. So truth's on our side, and sometimes right does make for might. But what's the slingshot? I think there has to be two types of leverage emphasized. The first, I think, is happening, and that's guideline control. Take the guidelines away from Humpty Dumpty. Take the guidelines away from professional associations. Have them done more by generalists. gear the guidelines to general practice, give general practitioners much more power over determining what treatment is. But the second important thing is we have to convince the public. And the one criticism I have of this great meeting is that there are no storylines coming out of it for the press. I had a reporter contacted me before the conference and said, tell me how I can sell this story to my editor. And what I said to him was, this is the most important story in health in the world today, overtreatment is. And there's evidence every year accumulating on how so many different procedures no longer can justify themselves. And we could save $1 trillion in the United States and a lot of unnecessary patient pain. And he said, where's the hook there? I can't sell that story. There definitely needs to be a press part of this conference and a press part of all of us that has a rapid response to all the headlines that say personalized medicine will cure everyone's problem. There needs to be a rapid response to bad stories, and this conference should be generating stories that appear in the New York Times. And I think it's important for all of us to figure out how our efforts can be the slingshot, because the Goliath is awfully big and we're awfully small. Thank you.